All right, we're going to go ahead and get started. I thank you all for being here. I'm Alicia Ellis, and I'm so very excited to present to you motivational interviewing and how to engage with your patient. I am very interactional through this. I want to hear from you. I'll ask and solicit responses from you because I want this to be meaningful to you. I can give you all the scenarios from my experiences from my field, which is counseling area. I'm a licensed professional counselor, mental health service provider for family and children's service. Also provides some supervision for counselor educators and teach in undergrad and graduate level in counseling programs in a couple of universities around town. So that's just a little bit about me. You'll hear more and more as I go forward. But I want to hear from you. I want this to be meaningful again for you, but to hear how you can use this in your setting. Motivational interviewing is just that. It's how to motivate the client to meet their goals. I love it because we talk a lot about the spirit of motivation, the spirit and why we do or how we do what we do. I learned a long time ago, I love and do what I want to do with clients because it is my goal to educate, to empower, and to excite them to take those steps to meet the goals that they're trying to meet. How wonderful. I can do that in each setting. And motivational interviewing and these tools are helpful in that process. The style and spirit of motivational interviewing is client-centered. It's not us going in as the expert, as the authoritarian, with this agenda that we're going to impose upon our clients, our patients, our parents. It's incorporating, invoking them, bringing them into the process, making it about them, finding out what they want in this process of change. What are some different examples that you engage with your clients, your patients, parents, and there needs to be behavior change? What are some of those particular changes that you see and work with? Anybody? Smoking. That's a big one. And with smoking, it's very difficult to stop. How many clients or patients do you see month after month, week after week, year after year, and they're still at stage one trying to stop smoking? How does that feel for you when you're not making or seeing progress in that client? Frustrating. Absolutely. And that's across the board with any behavior change when that client, that patient is not making any progress. And we're beating our heads. We can see that they can be successful. We know that this would benefit them greatly if they would engage in this behavior change. But a lot of how we approach it and how we pull them into this process has a lot to do with their success. So that's what we're going to talk about today. What do we do with their resistance? Who meets client resistance, patient resistance? I see it almost every day. How do you approach it? Do you engage in a power struggle with them? Do you chastise them? Do you take the parent role? There are many ways that we could. Yeah, I see some nods. Yes, thank you. Because I have done that before. I had to step back. I'm not the parent. But guess what? They have everything within them to meet these challenges, to take the next step. But what I can do is provide an atmosphere conducive for that change to take place. Instead of engaging in a battle with them, What I can do is find out what barriers there are that exist. How many of you know life happens? And that for many of our patients and clients, a lot of their lack of follow through has a lot to do with what's going on in their lives. They face many barriers. And I've heard it through the last two, but what's one of the major barriers that our clients face or patients? Time. I don't have enough time to come in. What about transportation? Childcare, finances, insurance. It's a biggie. They may be missing appointments, or they may not have taken that first step that we've talked about for a year now. Now I'm frustrated, and they see that when we engage, and guess what? It's not going to encourage them to continue in this process with us. So let's look at if we approach it differently. We're going to respect the fact that they have a choice in the matter. They have a voice. Do we elicit that from them? Do we find out what's important to them? Why would it be beneficial to you, or why is it important for you to have this discussion on, quitting smoking? The health risk, and my family doesn't like it. They hate to see me coming because I smell like smoke. It's really bad for my health. But I just can't stop. I don't know how to stop. They'll come up with many things, and we have to take the time to listen for what's important to them, why they're engaging in certain behaviors, what the barriers are, educating them. If they don't understand why it's so important for us that they take on this behavior change, again, create that atmosphere for change. It's collaborative. You'll hear me talk about the spirit of motivational interviewing throughout this, because that's what it is. It's the spirit in which we do what we do, how we engage our clients, bringing them in. This is a partnership for whatever change we're trying to get them to make. Clients, patients, they're much more invested when they know, one, they're not in it alone. Two, the provider really cares about what it is that they're trying to do. If a client comes in or a patient comes in to you and you're telling them, smoking is really interfering with your health, and I need you to do this, without considering all of their barriers, all of their concerns, their reasons and purposes for smoking, how successful will they be? What about evoking that which is already within them, their resources, their belief that they can be successful at this? How successful do you think you can be? From 0 to 10. If they tell you 2, that's a conversation. Why not a 10? What do we need to do to move you up on that scale? We want to empower them. I have clients, and I may ask them to make a change, and I get looks. If looks could kill, you've heard of that. And I sit there and I say, I know you don't like this. You're not excited about this change. But if you meet me halfway, if you just think about it right now, and let's have this conversation about what it might look like if you took part in this. What would that look like for you? Engage me in this conversation about change. The outcome is a little different. I had a client to tell me a few days ago, or weeks, that 6 months ago, when you asked me to take a chance to look at this behavior and change it, and to have that discussion, I was ready to leave. I was ready to walk out and end our sessions at that point. I saw it all over you. I saw it in your body expression, your facial expression, but I didn't quit there. I asked her about that. How were you feeling? What were some barriers? And we engaged in that process. And 6 months later, she's walking in that change. Does she have a long way to go? Absolutely. But she's made several steps at making that change. And in her words, it was because she was heard, she was understood, and that she felt that someone believed that she could do it and pull that out of her. She came up with the actual steps, those that were feasible for her. Not some that I came up with that I know that are workable, that didn't fit her lifestyle. So I involved her in that process to find out how we could make this successful. What are your barriers? What other options do we have that we can help make you successful in this change that you want? And when she was being resistant, when she really was not ready to make the change, I simply asked the open-ended question. On one hand, I hear you saying you want to do this, but in this hand, I see these particular behaviors. Let's have a conversation. Do you mind if we talk about that? And we're going to talk about the importance in a little bit of asking permission to have that discussion. What does that do for a client or patient? You're asking their permission or asking them for their input on your treatment plan, on your service plan. It empowers them. It engages them. It makes them a part of this process. And if I'm a part of it, I'm more likely to follow through. If it's all about you and what's important for you, I might not place it at the top of my list of priorities, even though the outcome is more beneficial for me. I tell my clients, from the moment you call, from the time you enter our door, you should be treated with respect. That means that I also, in that session with you during your time, I need to respect your views, your thoughts, and whether or not you're not ready to discuss or go over that at that time. I have to respect that. Now, I do understand that sometimes in healthcare it's a little bit different because some things need to be addressed, but there's still a way to maintain that level of respect and have that discussion with them so that they feel like they are a part. Did I roll backwards? Again, we need to express empathy, seeing things through their eyes, understanding what's going on in their lives, understanding that these barriers exist. It may be finances. It may be that I don't have insurance, I can't afford the medication, or what I hear often, I want a healthier lifestyle, but how many of you know it's expensive? I hear that quite often. Or I don't know how to prepare healthier meals. There are resources out there. If that discussion takes place, there are resources that we can give clients, that we can give patients. We can do some research or guide them. But if we don't open the door and set the atmosphere for them to feel comfortable enough to have these conversations and to know that they have a voice in this matter, it might not happen. I was sharing with the other groups that when I started this process, it made me look at my own behavior and my own health care, my own doctor, my nurses, and my approach to that. How many appointments have I missed because I didn't follow through with what the doctor said? I had a colleague 2 days ago, to say, drop her head and say, oh my goodness, I have to go back to the doctor in 2 weeks. He told me to do something 6 months ago. So I'm going to do it now in these 2 weeks, and hopefully there's enough change that he'll recognize that I at least took a step. But she dreaded it, her whole body language. And it wasn't intentional. Her nurses, her doctors, it was more of a paternal role that was taken. They didn't shame her or make her feel bad. But our perception going in, what's our perception? Again, we want to avoid argumentation. We want to support self-efficacy. For change to occur, clients must be ready, they must be willing, and they must be able. How many people personally has any of you caused to change? Single-handedly, you made someone change. Nobody? What do you need for them to make a change? Their active participation. Yes, they have to be ready. They need to make it a priority. It needs to be important to them. And they need to be confident that they can make the change. One of the huge pieces that really caused a lot of my stress and frustration to wane was recognizing the stage of change. How many have heard about stages of change? Could you take one and pass, please? Yes, stages of change. If I understand what stage my client, my patient is in when they come in, and I meet them with the appropriate response, it's a lot less stressful. What happens? A lot of times, our patients, our clients, parents, could you pass those around, please? Come to us, as you'll see there, once you get a copy, in a pre-contemplative stage. They're not ready. They're not even aware that a problem exists. But we're ready for action. We're ready for them to take our steps from our action plan or from our treatment plan and begin to implement them. But what happens is resistance is created. Frustration will happen on both parts because we're not meeting the client where they are. So what do we do in that stage? We provide more education. We begin to show how there's a discrepancy in their goals and what they want and their behaviors that they're currently participating in. And that helps to prepare them to move them along the continuum. Then there's the contemplator. I know that this problem exists. I know that I need to stop smoking. I know that I need a healthier lifestyle for me and for my family. But I'm not quite yet ready to make that change, and usually we gauge it by 6 months. I don't see myself making this change in the next 6 months. As a provider, what do? You continue with the education. You continue creating that discrepancy, showing them, implementing coping skills, showing them the risk of continuing in that behavior. And engaging them. Hopefully, eventually they'll move into the preparation stage, where then you can have discussions about barriers, planning, educating them on the importance of relapse. It's going to happen. It's a part of change. And setting the stage for a relapse prevention plan early on so that when it occurs, it doesn't stop them from the changing process and the behaviors. All of this will increase their level of confidence and their ability to see this through and to know that they're not in this alone. How do our behaviors elicit or increase resistance? I touched on some of them already. Arguing for change. You know, you really need to stop smoking. We've talked about this before. You know, your condition is worsening. And it's not good for your family. How engaged will the client be if that's what they're going to hear each time they see you? What's the likelihood that they will miss the next couple of appointments? Yeah. Assuming the expert role, yes, we have the knowledge, we have experience with certain behaviors time and time again, but that person is the expert in their life, on their lives rather. So they can share with us, one, why it's not working for them, why it is important again, and then how we can better help them. And as a team, move them to that next step. Criticizing, shaming, blaming, labeling does not work. It actually has the opposite effect of what we want. How often are we in a hurry and we can't really attend to someone, give them our full attention? We're backed up. How engaging is it if I'm just at my clipboard asking a couple of questions, rarely engaging in eye contact? What message am I sending? Yeah, I'm not present with you. In that moment, I may not that I don't care, I'm busy, but to them, that's the message they're receiving. And then we talked about the paternalism. We can't treat our patients like children. And I'm very bad with that, or have been, because I do care, and I am a nurturer by nature. And so I have to pull back to allow the autonomy and to allow that client into the process so that it is meaningful to them. And just a thought, people are not resistant to change, they resist being changed. You can't change me, but you can help me get there. Help me understand my world, my view on this. Help me to understand the importance of it. I'm going to show you a little clip in the end, and just the approach that the doctor takes was very meaningful for this patient. He gained awareness through education. He learned how to make it. The doctor gave him other options because his way wasn't as successful as they thought and wanted, but it was the approach. And he left or ended that time, that appointment, feeling encouraged to continue forward. He was motivated to continue even though he had relapsed. It all makes a difference. Now, to incorporate this motivational interviewing, we use ORS, open-ended questions, more so than a closed-ended, because we can elicit more from and find out more from the patient. I can't tell you the number of times that I've given or had my initial interview, and some information I need to get, and some information it is closed-ended questions. And every time there's a but. I need to explain. Well, I can't rush them through that process and negate the information that they want to give, not if I want a full understanding of this client. Affirm and recognize their strengths. Even if they've missed several appointments, let's say they've missed 6 appointments. That was huge with the other 2 crowds. On that 7th appointment, affirm the fact that they made it. Maybe the weather has been bad. They may have had multiple bus transfers or no transportation, childcare issues. You know, I'm glad you made it here today. It goes a long way. They might offer up why they have missed those appointments and then together work on a plan for being more successful with meeting and completing appointments. Reflective listening is huge. Active listening. If you ask a question, please take the time to hear the answer and to understand the position of that person. How many times has someone asked you, "Hi, how are you?" And by the time you can respond, they're already down the hall. Or they're on to the next question. Do you feel heard? Do you feel valued? Same with our clients, with our patients. Take the time to listen. Summarize what has occurred. Again, I heard you. I understand. This is what I got from that. What that does is give them an opportunity to say, almost, but not quite what I meant to say or convey to you is actually this. Or it gives them an opportunity to say, am I understanding you correctly in that these are the steps that you want me to take? Again, we can establish a deeper rapport by asking the open-ended questions. We want to elicit what is important to that person. How often do you enter and it's just your agenda? I had a intern this week, very frustrated. She said, I can't get to my goals. I can't meet my goals. I go in with an agenda and it's so frustrating that the client won't let me get to it. That was yesterday. And I sat back and heard her out and listened to her and then said, well, part of the issue there is it's your agenda. What's important to the client? What was it that they were trying to convey? Well, she had missed a lot of that because who knows about the committee in your mind? That's always telling you what you should be doing or what's next on your list of things to do. Well, that committee was working overboard for her, so she missed a lot of what the client said. How often do we do that? Again, demonstrating respect, affirming autonomy, and planting seeds is huge, especially when you're not in a position to really see the change. If we take any of these steps, it can plant the seed for that person to at least make it to the next step, to the next person, maybe to the next appointment. Ask twice as many open-ended questions. That's just to keep them engaged, get them talking. We don't want to be in a session or an appointment doing all of the talking. Keep your questions clear and brief. What happens when you have someone that does not really understand? And they've sat there quietly, attentively, and you've gone through so much. And then by the next appointment they come, you ask how follow through. If they follow through, they say no, they haven't made any progress. Well, what's going on? Let's talk about it. Well, I didn't understand. This can happen a lot. One, the population that we deal with or work with, they're afraid to use their voice. That has been the way that they have come up. They're afraid to ask the questions or to say, I don't understand. But again, if we create the environment, we can begin to have those questions and make it safe for them to say, hey, you know what, I just didn't understand. Or to call back even after they left and say, hey, can you go over with me what the doctor wants me to do or what that regimen, what was I supposed to do again with my child? What was that appointment? If we set the tone for that. And we don't want to negate our open questions with closed ones. That goes back to rushing through. One easy way to generate change talk, which is what all this does, is the acronym darn cat. It's a kind of cute way to remember. We want to understand their desire in the process, whatever it is, whatever the change is. What do you want to happen? Yes, we know what needs to happen. What's your desire in this process? Again, with the ability, reasons, and need. Let's get that from them. Again, keeping them involved throughout. Commitment, activation, and taking steps. What will you do next? It doesn't matter how big or small it is, as long as they do something. If it's that I'm going to commit to finding another route to get here to ensure that I make my next appointment. That's big. Acknowledge that. Affirm that. That's an effort on their part. What are you prepared to do now? You've shared with me that, there are some great barriers. What is it that you can do right now? And in taking the steps. What does reflective listening look like? Again, I've gone through most of these because I get ahead of myself with this. But reflective listening, again, it just emphasizes that you hear them, you understand, and you do that by repeating what they're saying. It could be the exact phrase, or if you want to be a little more creative with it, you paraphrase, adding meaning. And I love this part because our clients can say no or yes, that's exactly what I meant. Or what I hear a lot, you understood me. You get it. You understand why this has been difficult. And you understand that I really do want to make this change, but it's just not that easy for me. Add reflections of feeling. I hear that this sounds frustrating for you. Let's talk about that. Again, that a lot of times that will introduce the discussion to barriers. Reflective statements are not questions. They're statements. Your inflection turns down. So what I hear you saying is, it sounds like you're very frustrated. Sounds like you want to make this change. And then even if it's for a short amount of time, that listening to the client is important. How many of you don't have a full hour to spend with a client or with a patient? Yeah, many of you. So you may be looking at me like, yeah, that might be good for you in your world because you get 50 minutes to an hour with a client and you can do all of this. But I'm going to show you that you can implement these, the ORs, darn cat, just these simple questions and way of being in a very small amount of time. Again, it's an invitation, allowing that person in to this change process. Asking is not listening. Again, you don't want to ask a question and not take the time to hear and to understand. Asking permission. Would it be okay? Offer choices when possible. If the patch didn't work for you, let's look at some other things. You said you were successful in the past. What worked for you then? Talk about what others have done that was successful. Maybe they can incorporate that. And always acknowledging that the decision is ultimately up to the patient. Again, that empowers them and gives them some ownership.